This presentation gives a brief overview of the Indian Health Service Injury Prevention Program. I'm Billie, Indian Health Service Injury Prevention Program Manager. The Indian Health Service, or IHS, an agency within the Department of Health and Human Services, is responsible for providing health services to federally recognized American Indians and Alaska Natives. In 2021, there were 574 federally recognized tribes in the U.S. American Indians and Alaska Natives, which I'll also refer to as tribes, experience an injury mortality rate 2 times that of the U.S. all races rate. For this population, unintentional injuries are the leading cause of death for ages 1 to 54, and the third leading cause of death for all ages. Homicide is the second leading cause of death for children ages 1 to 4, and suicide is the second leading cause of death for ages 10 to 34. The IHS Injury Prevention Program works to address this disparity. The mission of the program is to raise the health status of American Indian and Alaska Native people to the highest possible level in a couple of ways. One is by decreasing the incidence of severe injuries and death to the lowest possible level, and also by increasing the ability of tribes to address their injury problems. The IHS has 12 geographic regions called areas. Each area has a unique group of tribes that they work with on a day-to-day basis. Each area has one or more injury prevention representatives. If you're interested in learning more about a particular area or tribe, feel free to reach out to the Area Injury Prevention Contact. Contact information for these injury prevention specialists or representatives can be found on the IHS.gov Injury Prevention website. These are age-adjusted unintentional injury deaths by area. The Billings area has the highest unintentional injury death rate among the IHS areas at 137 per 100,000. The lowest death rate is in Nashville area, 50.7 per 100,000. All areas have a higher rate than the U.S. all races rate of 37.5 per 100,000. These American Indian Alaska Native rates have been adjusted to compensate for misreporting of race on state death certificates. These and similar injury statistics are currently being updated. The Injury Prevention Program topic areas include both unintentional injury and intentional injury. The current focus areas of the program are MV, motor vehicle or traffic safety, and older adult fall prevention. Technical assistance is provided to tribes and tribal organizations in the areas shown on the slide. I'll provide more information on the training program and the grant program. The IHS Injury Prevention Training Program currently consists of short courses and a fellowship. The Introduction to Injury Prevention is a 3.5-day course which introduces the core components of the public health approach to preventing injuries among American Indians and Alaska Natives. The Intermediate Injury Prevention course is a 3.5-day course which reviews the basics of data interpretation, coalition building, program planning, evaluation, marketing, and advocacy. The Safe Native American Passengers course is a one-day training which provides an overview of child passenger safety in AIAN communities, Alaska American Indians and Alaska Native communities. The Injury Prevention Fellowship Program is a 12-month advanced learning experience for individuals promoting injury prevention in tribal communities. The short courses and fellowship are currently under revision. The IHS provides funding for tribes to develop programs and interventions to address the disparity in injury rates throughout tribal communities. This is completed through the Tribal Injury Prevention Cooperative Agreement Program, known as TIPCAP. Established in 1997, TIPCAP has funded tribes in 5-year cycles. There is a report on the first 20 years of TIPCAP on the TIPCAP webpage if you would like more information. The 2015 to 2020 cycle funded 31 sites. A new cycle of TIPCAP began in 2020, which currently funds 27 sites. For more information, detailed information, please visit the TIPCAP webpage. In addition to the previous items mentioned on the IHS Injury Prevention website, there is also additional program information. There is also a listserv to subscribe for updates and partner announcements. The first National Conference on American Indians and Alaska Native Violence and Injury Prevention was held in 2019, and I'm happy to announce that the next conference is coming up in the summer of 2022. Visit the website or subscribe to the listserv for this and other IHS Injury Prevention Program updates. Thank you for your time. This concludes this presentation.